Thank you, Madam Speaker. Thank you, Chairwoman. It's an honor to be here today. My name is Mindy Salango. I'm from Morgantown, West Virginia, and 27 years ago, I was diagnosed with type 1 diabetes. I could go in and tell you all about how that affected my life, and it did. It changed my whole career course. I now have to look for jobs and will only be able to take jobs that have insurance due to the high cost of prescription drugs and insulin that I have to take, as well as all of the supplies and equipment that I have to use. I decided to become an advocate because when I found myself as a single mother, I didn't have very good insurance, and I found that I was paying outrageous amounts of money in order to live. And I had a young daughter, and in order to keep food on the table and a roof over our head, sacrifices had to be made. And oftentimes, that was my insulin. The average lifespan for a diabetic without their insulin is 24 to 48 hours. So you can imagine if you walk into a pharmacy and your card declines because you don't have enough money to pay for your insulin, the fear that you walk out with. I'm lucky. I had some support and was able to fall upon my mother and my sister, who are amazing. But we shouldn't have to do that. We shouldn't have to go to the kindness of others. I shouldn't have to ask my single mother or my sister, who is also a single mother, to help me out with those bills. I should be able to provide for myself. I work full-time and I work hard. So, as my situation improved, I'm now able to afford my medication a little bit better. It's still tight. We still go paycheck to paycheck. I decided to advocate. And as I have become an advocate over the past year and become more visible, in the past year, I've been asked 6 times over social media if I had extra insulin or supplies that I could spare. And I have met people in a parking lot to provide them with insulin and supplies that they need to survive. We're not criminals, and we're meeting in parking lots like we're criminals. This isn't healthcare. This is not healthcare. This is survival of the richest. The drug companies have stated that they have made record profits during a pandemic. They have made record profits at the expense of the lives of diabetics and other folks who have chronic illnesses that need their life-saving medication to survive. Type 1 International did a study before the pandemic that said 1 in 4 diabetics in America were rationing their insulin due to cost. Studies are coming in that during the pandemic, that has raised to 1 in 2 diabetics who are rationing their insulin due to cost. Again, I state, this is not healthcare. The Build Back Better bill is amazing and is probably the most transformational piece of legislation that will have passed in my lifetime. However, the fight doesn't stop. We still have to ensure that the uninsured and the underinsured are protected, because even with the Build Back Better Act, they will still pay full price at the counter. I hope none of you ever have to go to the pharmacy and walk out without your life-saving medication. I hope you never feel that terror, because our only option is to pay or die. So I thank everyone who has worked so hard for this. We need this. It will save lives. Thank you. Thank you very much.